All right, so here is your communications lecture. Um, well, communication is what we do every day. We communicate with everyone. And so we are going to learn about how we do it with patients. So we want to focus on verbal communication versus nonverbal communication. So verbal is spoken speech. We use vocabulary. It has meaning. Pacing is kind of like the speed that you're talking in. Intonation is your tone. Clarity, timing, relevance, credibility, and humor. Humor is a pretty good way of communicating. And so, yeah, all those are components of verbal communication. Now, for nonverbal, what we see, and it's still a type of communication because they're giving us a message, it's facial expressions, posture, personal appearance, distance, gesture, touch are all components of nonverbal communication. What are some factors that influence communication? So developmental level. So we do know that when we speak to children, we speak to them differently. Maybe somebody with Alzheimer's or dementia, we definitely speak to them very differently because they do have they're at a different developmental level. Gender, um, gender will influence the way we are perceived and the way we try to communicate. Social cultural differences. That one would include anything like some cultures make eye contact and some don't, and things like that. So those are just how that would influence communication. Roles and responsibilities. Well, in any communication situation, we have roles and responsibilities. So, there are two roles, and, one that's communicating and one that's intaking that communication, and what is the responsibility of either or. Space, and I don't know how to say this word, or it's very difficult for me. Territoriality. So that's just kind of like where are you at in the room, how close you are to the person, in what space are you. Physical, mental, and emotional state. So that's a very important one, especially in nursing, because all those things can affect your communication. So physical is like if you are very far away from a patient that is deaf or hard of hearing and you're having trouble communicating with them. Mental state, well, if somebody is anxious or going through some sort of maybe manic phase, they might not be able to communicate with you and you might not be able to communicate with them. Emotional state is the same. So if they are in a high emotional state, they might not perceive anything that you're saying. A good example of that is, say, a newly postpartum mom that delivered like around midnight, and then she shows up to the couplet floor. She's probably exhausted. Hormones are all crazy. She's, she just had a baby. Would it be a good time to teach her anything? Probably not. And those are, the things that you can see that influence communication. Values, well, everyone has different values, grew up with different values, and so we have to take those into account and how they will affect our communication. Environment, this is a really good one as well because an example would be in an ICU room with all the beeping machines and all that is going on. That would definitely influence some communication. So electronic communication is kind of like a newer thing in nursing. As you can see, the sub bullets here are social media, email, and text messages. Social media is highly used, of course, around the world, but it's one of those things where we have to recognize that how we communicate and use social media can affect us as nurses and our career. We have seen a lot of that lately with this COVID pandemic. So just know both the American Nurses Association and the National Council of State Boards of Nursing have guidelines for registered nurses regarding the use of social media. Email and text messages, this is more like not patient interaction, but more coworkers and things like that, you know, talking to your manager and such. However, you do have to know that emails and text messages can risk violating patient privacy and confidentiality. Anytime text messages are sent electronically, unfortunately, they run the risk of being hacked and information being leaked. So healthcare agencies usually have security measures in place to safeguard emails and text communication. So the phases of communication, this kind of sounds familiar, doesn't it? I think we learned about it before. It's the same thing as the nurse interview. So we have the preparatory phase where we're going to prep for the interview or the moment of communication, whether that's gathering your materials, making sure you're logged into your computer, and all those things. The orientation or introduction phase, that's when you tell your patient that you are going, you introduce yourself and you explain everything that's going to happen and make sure answer any questions they might have, and explain exactly how this interview or communication is going to go. The working phase, again, it's that meat and potatoes of communication. So this is where you'll do the bulk of the communicating. This is where you'll collect all your information, but it has to be done in a therapeutic manner. And this is what this whole chapter is about, that working phase, but how do you do it therapeutically? And then the termination phase, again, it's the ending of that communication or that interview or, that initial assessment you're performing. So that's what it is. Therapeutic relationship. Well, so that actually kind of explains the relationship that we have with our patient. That's that nurse-patient relationship. It's called therapeutic because we're helping the patient. It's personal, it's client-focused. We aim at realizing mutual determined goals. We help the patient increase feelings of self-worth, promote insight, encourage problem solving, facilitate decision making. So that helping relationship, it's a therapeutic relationship, and what it is, it's dynamic, means both the person providing the assistance and the person being helped are active participants to the extent each is able to. It is purposeful and has a time limit. That means there are goals specific and they are intended to be met at a certain time. Although both parties in the helping relationship have responsibilities, the person providing the assistance is professionally accountable for the outcomes of the relationship and means used to attain them. Helping persons should present their helping abilities as honestly as possible and not promise to provide more assistance than they can offer. So just remember, in any communication, but in this helping communication or relationship, don't overextend yourself if you can't complete certain things. So this is one of those things where you want to be as accurate as possible, and don't promise things you can't do, because that will hinder that therapeutic relationship. So factors that promote effective communication. I have those divided into two. So the first one is dispositional traits. So dispositional traits are characteristics or kind of some customary ways of behaving. So nurses who consistently demonstrate warmth and friendliness, openness, rapport, empathy are usually more provide effective communication. So warmth and friendliness is, that initiating that helping relationship, and being pleasant and friendly, smile, although with masks it's kind of hard, but still you can, radiate that warmth and friendliness. So openness and respect, effective communication, you should be open, accepting, respectful, and without prejudice. If you're judgmental, that patient might not really want to communicate with you. Developing some sensitivity techniques would help, and then paying attention to variables that influence the way you communicate, such as your biological sex, cultural life experiences. Empathy. Empathy is an objective understanding of the way in which a patient sees his or her situation, and identify the way another person feels, putting yourself in another person's circumstance. And so that's that common putting yourself in someone else's shoes. And so having empathy will help provide effective communication. So a good way of providing empathy is, instead of saying, I know how you feel, it would be more like, I understand that this is a hard time. How are you coping? Is there anything I can do to help? So those are really kind of open ways to show that you're empathetic, as opposed to just saying, I'm sorry for how you're feeling, and then ending it that way. So that wouldn't be conducive to an effective communication, because it's almost like a closed-ended statement. Being honest, authentic, and providing trust. So honesty is important. I think I mentioned that in the last slide. It's, if try not to overextend yourself, that, where it puts you in a lie. So saying, I'll be back in 15 minutes, but it takes 25 minutes for you to get back, well, that's, not trustworthy. And so, providing honest information and making sure that you're providing that trust will help that effective communication. Caring. I think a lot of us who are nurses or nursing students have that trait. We're all caring people to some extent, and you will see it with nurses who are maybe a little jaded, and especially right now with this whole COVID-19 stuff, you'll see some interactions that don't show that caring aspect that we all know nurses have. Competence, and that is something that will come with your career. You might not feel competent in the beginning, but you are. You know all this stuff. You will know all this stuff, and that patient seeing that you're competent will definitely provide some effective communication. The second one is the rapport builder, or rapport. So rapport itself is kind of like a mutual trust. It's like a good relationship. It facilitates open communication. So have specific objectives for your patient. So letting them know that there is a purpose for the interaction. Example is, I'm here to do your physical assessment today, or I'm here to give you medications for whatever reason. Be in a comfortable environment, which can be hard because, people in the hospital are rarely comfortable. A lot of the times they're disturbing their sleep, but we can find a mutual understanding in that. And that will help promote those interactions, make it suitable. I think in the book it mentions a comfortable environment, meaning enough light if it's dark, have patients' belongings at reach, make sure they're comfortable, things like that. Providing privacy, well, we know that's a big thing, right? We want patients to feel comfortable with us. We want to always make sure that we're providing privacy for them. However small the interaction is, we definitely want to make sure we're keeping privacy important and making sure it's dignified. So confidentiality, well, we get a lot of information thrown at us from patients, sometimes more than we want. However, as a nurse, it is one of our very, very important responsibilities is keeping things confidential. Patients will divulge a lot of personal things to us, and we should always keep that confidential, especially if it's something that shouldn't be communicated to other people. So this patient versus task focus, so I think that one's a very important one to go over, just because when we are busy nurses, we tend to treat our patients like transactions, like when you go to the store and get whatever you need and then pay and then go home, right? Well, we need to focus on the patient and not make it a task. And that's sometimes can be challenging, especially in busy units. So utilizing nurse observation. So that would be seeing and interpreting anything and all information. So example would be if seeing a patient being anxious because they are waiting for the results of a pregnancy test, whether they're anxious regarding that they're happy and hope to get pregnant, or the opposite. Maybe they don't want to be pregnant and they are anxious maybe for having a positive pregnancy test. So it's definitely using that observation and seeing, understanding how that situation would go. And then that optimal pacing would be how you're talking to your patients. So have you had a Starbucks coffee and you're going 100 miles a minute? Talking like one of those, like I always think about this, and like auctions, how like in movies and you see the auctioneers with their like fast talk, like you could barely understand what they're saying. Well, so imagine that and you talking to a patient. So that would not work. That would not be effective communication. As part of your communication lecture, we do want you to know about handoff communication and how we communicate with other healthcare workers, whether that is a nurse to nurse communication, nurse to CNA, PCT, nurse to doctor, nurse to, any other, physical therapy, occupational therapy. So we have this kind of standardized way of communicating. It's called handoff, and it's shortened to SBAR. So the S is situation, B would be background, A is assessment, R is recommendation. So the situation, if us as nurses, we will have a patient that we will give SBAR about, and so that would be, what is the situation of this patient? So this is Mr. Jones. He is 75. He's here with a COPD flare. His oxygen is at 89. He's on this medication. His vitals are, and we tell them some vitals. And then you can go into the background. So the background would be the patient is alert and oriented, ambulates on own, is on oxygen. We do have an IV, fluids running, and then your assessment would be any of the issues you have found. So the patient's oxygen is low, but he's already on O2. Then the recommendations would be, I would like a blood gas reading. I would like to increase the oxygen, or maybe this patient needs something other than oxygen, like CPAP, or whatever the recommendation is. And then see if you get those orders. And that is how you would communicate. Of course, every SBAR would be different because you'll be reporting or handing off different patients. So it's something that you will practice, and eventually it'll pretty much just come out naturally. Just know that it does take some practice to do this. So communication with special needs. So we have to be cognizant of different things that can happen in communication, such as taking care of somebody who is visually impaired, who is hard of hearing. Maybe there's physical barriers for the patient communicating with us. Cognition is one of them. What about patients who are unconscious? And then patients who don't speak our language. Those are some considerations. And then this table here has some really good recommendations on how to speak to people or patients with special needs. And I'm just gonna blow it up a little bit. It's kind of hard to see on this PowerPoint, so 1 second. And this chart is in the fundamentals book, so I'm not gonna read through all of it, but this is just some information because you will encounter all sorts of communication barriers with patients. So with the visually impaired, some things would be, of course, identifying yourself. This is something you're going to do anyway, but identifying yourself so you don't scare the patient if they can't see you. Explain anytime you're going to touch, make sure you're doing it before you actually do it. And then maybe just orienting the patient to the environment and what's going on. Maybe they're in a busy unit with lots of beeping, so maybe they want to know what's going on. Some hearing impaired would be make sure you're talking directly to the patient. If they need an ASL interpreter, use an interpreter. Maybe write ideas that you cannot, verbally express. Directly talking to the patient, maybe they can read lips, and thinking about that now in this kind of COVID era, We have those masks that are clear on the face so that people who are hard of hearing can read lips if they're able to. So what about people who are intubated or who had a laryngectomy? They won't be able to talk to you. So those are things you can use some considerations. So be more simple. Options include blinking eyes or squeezing hands. We've all seen like movies, right? On how to communicate with patients. This always reminds me of the blink twice if you're in trouble, blink once if you're okay, and things like that. We come up with ways to communicate with our patients and ways that they will be able to communicate with us. So just take a look in the book. You have a lot of, this chart here is pretty good at going through patient communication issues. So what are therapeutic responses? Therapeutic responses are those type of ways we react to the communication with our patients. So what seems therapeutic would be something that shows our patients that we are listening, we are trying to help. So things like seeking clarification. So if you didn't understand, how would you, making sure that you understand what they're saying. Reflecting, so reflecting on what they're communicating. Offering selves, that's just making sure that you are giving your undivided attention. Restating, so that the patient can verify that you are listening. Using silence sometimes can help, think about those situations where maybe a patient was recently diagnosed with cancer and they're teary. You don't necessarily have to talk to provide a therapeutic response. Silence is sometimes good. So just in the book, go ahead and you will find many therapeutic responses, and think about them and think about how maybe if you work in the medical field, how you've used them before, and I'm sure you have if you've worked in the medical field, or even with any interactions with family members and things like that, and you'll see that those are ways for therapeutic responses. Non-therapeutic responses, well, it's the opposite of what we just talked about, but so think about maybe if you've gone to the doctor or been in the hospital for whatever, things that just didn't make you feel right in sense of like communicating with your provider or with your nurses, or that interaction you had with people during that time. So reassuring, yes, it sounds like it's a therapeutic response, but sometimes it's not correct. So telling a patient everything's going to be all right when you do not know if that's the truth, right? Yes, it is a reassuring response, but it's really not truthful and it's not therapeutic. Rejecting, so just kind of, maybe they're worried about something and you just overlook it to hopefully make the patient forget about it. Disapproving, this is a good one with having maybe a substance abuse patient, so having that kind of negative feeling towards that patient, like disapproving of their actions. So I feel like I'm trying to think of a good example of that one would be I have a substance abuse patient and they ask you if they're going to be okay, and your response is, well, it's hard to tell. We don't know how long you've been on drugs, or, you know, so it's really like a disapproving statement. It doesn't make the patient feel good. It's not therapeutic. Probing, so probing is asking like asking questions that you are trying to get a response, but if the patient isn't responding to you, it's probably not, you shouldn't continue trying to get that information. It's not therapeutic because it's almost bothersome. Requesting an explanation, that's the why did you do this? So I'm thinking of the gentleman who had a knife in his head. Really, would you ask him why he did it? Would it be an appropriate thing to ask? Probably not. And this is very true for psych patients, and you're going to learn in your psych, in block 2, which is where you take your psych stuff, you're going to learn that you should never ask why. So why did you try to jump off a bridge? It's kind of a tough thing to explain when you're not in the right mind. Making stereotyped comments. Well, we know stereotypes are not good. And then introducing other topics. Well, how would that help in therapeutic communication? You're basically talking about something else when really you should focus on what's going on. So that is not therapeutic at all. So developing conversation skills. We all have conversation skills, don't we? We've been talking since who knows when. But this is something that will come in your nursing career, especially as you go through like your clinicals and stuff like that. You will learn how to talk to your patients. The tone of our voice can convey a lot of information. So if I sound like I'm angry, then I'm gonna sound like I'm angry, and that is not a good conversation skill. Be knowledgeable. So this one is especially because we are nurses and we are educated and we have a high standard of education, is know what you're going to talk to your patient about. And if you don't know, look it up and then talk to your patient. Be flexible. That kind of goes with the knowledgeable. So if you don't know the information, look it up. Be flexible. Reassure your patient that you can look for the information. Be clear. Don't mumble. That is a good conversation skill. Avoid words that might have different interpretations. We'll learn some of those in class. Be truthful. So be as honest as you can. Don't lie. It's pretty much very important in communicating with our patients. That includes, I'm going to be back in 20 minutes, but it took you 30, 40 minutes to get back. Instead, you can say, I have to go take care of something. I don't have an exact time when I'm going to return. Maybe in the next 30, 40 minutes. And actually remember to come in that 30, 40 minute window. Giving a window actually gives you more time and makes it be more truthful. Keep an open mind and take advantage of available opportunities. So just work on your conversation skills. Talk to anybody and everybody. I know it's kind of weird with our COVID stuff, but interview your family. Develop a patient report. So that'll be very helpful. So blocks of communication. So these are like, so yeah, these are giving false assurance, being judgmental. We shouldn't judge our patients, no matter how crazy they may be sometimes. Yes, that's a judgment. But so knowing that each patient you encounter has a backstory, has their own troubles, has whatever situation going on, and that we shouldn't judge them and we should treat all of our patients the same, because that will help in your patient communication, but it will help it make your life as a nurse pretty easy. And it's something you will learn because we're human and it's pretty hard not to judge people, but we work at it, and you will see how big of a difference it will make when you hold those judgments aside or not even have them anymore, and your communications will be great. So using closed-ended questions, that one, well, you ask the question, they answer it, and that's it. There's nothing else to give. It'll block communication because it will sound like you're not seeking any more information. You want to keep that communication going, especially if you're trying to assess or doing your initial assessment. So closed-ended questions tend to make patients feel like that's it. I don't need to do anymore. I don't need to answer any more questions. Inappropriateness. We will see examples of inappropriateness, unfortunately, because not all nurses are appropriate. Using cliches, changing the subject, probing, failure to listen. Those are all blocks of communication. So as nurses, we want to have excellent communication skills, but especially we want to provide therapeutic communication for all our patients. All right, you've made it to the end of our communications lesson. So we will see you in class.